Okay, so let's continue on with slide number 9. In 2010, the Congressional Budget Office, which provides estimates of the cost and impact of all major legislation, originally projected that the coverage provisions in the health reform law will expand coverage to more people by 2019 and reduce the number of uninsured from 50 million in 2009 to around 22 million in 2019. We did not really achieve this, but the Affordable Care Act, the law itself, reduced the number of uninsured to 28 million, which is about 6 million short of the original projection of 22 million, down from 50 million in 2009. Between 2010 and 2013, the uninsured went down from 50 million to 44 million because of the early provisions put in place by the law. We're talking about, those young adults below 26 years old being able or being eligible to be under their parents' health insurance policies. And then also the expansion of the high risk pool for the states where they could insure high risk individuals with pre existing conditions. Between 2014 and 2019, after the major provisions came into effect, that would be the Medicaid expansion and the individual mandate and the establishment of the health insurance exchange, the uninsured further went down to 28 million. I just believe that the remaining 6 million uninsured, which is the balance or the what is short of the original projection, is because of those states not expanding their own Medicaid programs, as well as the practical elimination of the individual mandate effective the start of the year of 2019. So, how about improving health insurance? So, in addition to expanding coverage, the law also seeks to improve the adequacy and the affordability of the coverage that people have. So, no insurance market rules will prohibit insurers from denying coverage or charging people more because they are sick. In addition, insurers will not be permitted to rescind coverage except in cases of fraud, nor will they be able to place lifetime or annual limits on the coverage. Now, this is very important because it practically got rid of cherry picking, wherein health insurance companies before could deny coverage for people with underlying conditions. If you buy your health insurance coverage through the health insurance exchange, there is practically no medical underwriting. So there's no cherry picking involved. Also, it eliminated lifetime caps or annual limits on the coverage. So lifetime caps basically says the insurance company will say, okay, we can only spend, say, 3 million on you. So in case you get sick of cancer or something that's very, very rare, they will only spend up to $3 million for your treatment. After that, your coverage is gone. And that's a lifetime cap. That means they won't cover you after that. They also got rid of the law also got rid of the annual limits on coverage, meaning insurance before Obamacare, insurance companies can actually say within a period of 1 year coverage, which is typically the calendar year, they will put limits on how much they will spend on you. So they would probably say only 500,000 or $1 million. After $1 million within a 12 calendar month period, we will stop our coverage. So Obamacare literally got rid of that. Other changes will require plans to provide coverage for certain preventive services, such as mammograms, colonoscopies, diabetes screenings, with no cost sharing, no out of pocket. Many plans will be required to offer a minimum set of benefits and to limit what people have to pay out of pocket for their care. So we also know that now that if you go for your healthcare maintenance, your annual healthcare maintenance visit, that is of no cost to you, no out-of-pocket cost to you. The law includes new requirements and incentives for employers to offer health coverage to their workers. So originally stipulated for 2014, employers with 50 or more employees that don't offer affordable coverage will be subject to penalties of up to $2,000 per full-time worker per year, excluding the first 30 workers. The provision was delayed for a year and became a mandate in 2015. So recognizing the particular difficulty small employers may face in providing health insurance, the law exempts employers with fewer than 50 employees from the penalties, but they provide a reward. So the law provides a reward to the smallest employers that offer coverage by giving them tax credits to basically offset some of the cost of that coverage that they, even though they were not required by the law, but they still provided that coverage to their employees. One of the more controversial aspects of health reform is the requirement that individuals have health insurance, otherwise known as the individual mandate. So beginning in 2014, most people were required to have health insurance that meets minimum coverage standards. This mandate was included in the law to ensure that the requirement that insurers provide coverage to everyone could work. Without a mandate for coverage, some people might choose not to buy their own insurance until they get sick. And that defeats the whole purpose. Doing that would drive up premiums for everyone else, making coverage unaffordable for many. This new requirement will be enforced through the tax system, and individuals will face monetary penalties if they don't have coverage. Certain individuals, so that was the original intent of the law, including certain individuals that will be exempt, including those who don't have access to affordable coverage, those with incomes below a certain threshold, American Indians, immigrants who are not legal residents, and people in jail. The big but here is that, however, the Trump administration signed into law in December 2017 a bill that was passed by Congress that practically eliminated the mandate by reducing the penalty to $0. So by 2019, the mandate was practically eliminated because people no longer have to pay the penalties. It practically eliminated the individual mandate. One drawbacks of the law is that there will be some people that will remain uninsured, and this slide would actually talk about who they are. So despite the efforts to expand the coverage, like I said, some uninsured will remain. The Congressional Budget Office estimates that 23 million people will still be uninsured in 2019. We actually know that there's more because of what happened between then and now. The remaining uninsured include immigrants who are not legal residents and therefore not eligible for Medicaid or for federal premium subsidies in the exchanges. Also, people who are eligible for Medicaid, but they choose not to enroll. There are several barriers, especially in some other states. It's not that easy to enroll or sign up for Medicaid. Also, those people who are exempt from the individual mandates, in most cases because they do not have access to affordable insurance, and those who choose to pay the penalty instead of purchasing health coverage. Well, there's really no penalty anymore, as I've said. It is expected that many of the remaining uninsured will be low income, so that the need for a strong network of safety net providers to care for this uninsured will still continue. Hence, we have the federally qualified health centers. So not all people will be able to afford to buy health insurance, even with the health insurance exchanges. I'll show you to illustrate the amount of how expensive it is to some people later on in this lesson.